The American Cancer Society says more than 13,000 new cases will be diagnosed with cervical cancer this year. Organizations also predict more than 4,000 women will die from this cancer. The best way to fight those numbers is prevention and catching it early. And joining us now is Gynecologic Oncologist Dr. Allison Staley with AdventHealth Porter. Thanks so much for joining us today.
Thank you for having me. I appreciate it.
So let's talk about the causes of cervical cancer and how we can prevent it.
Yeah, so cervical cancer, 98% of them are going to be caused by the human papillomavirus, or HPV. There's a very rare grouping where there's no association, but by and large, it is going to be HPV related. 80% of adults, probably more than that, are going to have at least one infection of that in their lifetime. So I say this is an everybody problem. Thankfully, we do have a vaccine that's on the market, Gardasil. It came on the market in 2006, and currently it will cover 9 different strains of HPV, including some of our more high-risk strains for cancer.
And what age should you get the vaccine?
It is approved as early as 9 years old. Ideally, children are going to be getting this 11 to 12 years old. It does have approval up until the age of 45. However, it is most ideal if children get this as young as possible. We want them to be immunized early before they're ever exposed to it. You know, unfortunately, I hear a lot of parents say in the after effect that, you know, I wanted my children to have the choice. They can decide when they're an adult. And unfortunately, that just doesn't have great rationality. The safety is getting it done when they're very young. So please know, too, as a parent, that Colorado is an opt-in state, not opt-out, meaning with their school-age vaccinations, it is not a requirement. So when you're seeing your pediatrician, make sure that what they're offering and providing to your child includes that HPV vaccination.
Who is most at risk?
So there are going to be some populations that have even higher chances of developing cervical cancer. Now, everyone still needs screening, everyone still needs vaccination. But please know, if you're listening out there and you have an immunocompromising state, meaning you have a disease process that compromises your immune system, you take medications chronically that compromise the immune system, you are not going to be able to clear that HPV vaccine, or excuse me, HPV virus as easily. And so your screening probably needs to be more frequent. So confirm with your healthcare provider, are you in that population, and make sure you're getting screened more frequently. I'll also add to people who are tobacco users, you are going to be very high risk too of developing cervical cancer. In fact, if you need another reason to stop smoking or using tobacco products, this is one of them. 50% or more of our cervical cancer survivors are tobacco users. That is more than every other cancer survivorship, including lung cancer, combined.
Wow.
Additionally, in the last year, roughly, the NIH did a study and they looked at marijuana use. And they looked at people who used 1 joint or more a day. Those individuals are also at high risk of developing cervical cancer. So just because it is legal here in the state of Colorado, please be aware of what you're putting into your body and that it does really have effect.
Dr. Staley, thanks so much for all of that really important information. Thank you.
Absolutely.
And remember, you can watch all our interviews on our website, cbscolorado.com. We'll be right back.